These are the physiological effects of negative ions. They're decreased respiratory rate, decreased basal metabolic rate, decreased blood pressure, producing a feeling of well-being, increased vitality capacity, decreased skin temperature, acceleration of the conversion of succinate to fumarate, stimulation of cytochrome oxidase activity, decreases cinephilia and lymphocyte count, increased CO2 combining power of plasma, decreased blood sedimentation rate, decreased muscle connexia, increased cellular activity, increased frequency of mitosis, increased resistance to infection, and suggested therapy for chronic rhinitis, sinusitis, migraine, insomnia, tuberculosis, wound burn healing, asthma, hay fever, emphysema, bronchitis, conjunctivitis, clearing gas poisoning, and preventing the thromboembolism. Now, I didn't put all this up here to bore you, but I wanted you to see the scope of what we're dealing with. And these things have to be addressed in order to correct the problem. There are some units in Germany where they're using negatively charged oxygen to revitalize people, and they breathe this in, and they have little masks you put on your face. And I haven't been over there since they had this one out, but I want to take a look at that next time I go. The ones with the black dots represent a positive correlation. The one with the circles a significant correlation, and then everyone that's checked off there. So you start to look at whether the thing is going up or down or whatever, and what the weather does to it. But it's involved in psychopathy, excitability, schizophrenia, psychodisturbance, hypnotic collapse, neurosis, suicide, cold inflammatory pneumonia, appendicitis, bronchitis, bleeding, thrombosis, glaucoma, accident-prone, subjective complaints, heart, infarction, embolism, depth of sleep, spastic complaints, migraine headaches, general aches and pains, reaction time, decomposition of the heart, premature birth, heart failure, perforation of the stomach, diabetes, rheumatoid arthritis, epilepsy, colic, and angina pectoris. So that's a pretty good group, and that's probably not all of it. Emotional stimuli acting as stressors. Stress has been defined by Selye as the impact of external factors on our health. In addition to heat and cold stress, other factors may also impose on our health, notably pain, intoxication, emotional stimuli, infection, and physical trauma. The so-called limbic system of our brain reacts to stress via the hypothalamus and pituitary and produces an alarm reaction which stimulates the autonomic nervous system as well as the endocrine system to cope with the stress. The organs affected may be the stomach, heart, intestines, gallbladder, urinary bladder, CNS, lungs, muscles, and skin. Thus, many of the pathological symptoms and diseases shown on the last line can be produced by stress. And the last line is eczema, neurodermatitis, spasms, hyperventilation, insomnia, depression, dyskinesis, colitis, gastritis, cardiac disorders, functional cardiac disorders, and duodenal ulcers. Every one of these substances has a cyclic nature to it, the peak hour and the apogee and the perigee, the up and the low of all of these things. And I'm sure that this whole thing could be fitted into the Chinese organ clock. I haven't done it, and I got other things to do besides play with that, but I'm sure it could be done. Now, these are the cloud formations, how you're able to read the atmosphere. We have, in cirrus formations, we have negative ions, cirrocumulus, mixed electrofields. Cirrostratus is spherics, which means mixed electrofields, as far as I can understand or determine. Spherics is nothing more than short for atmospherics. Altocumulus is a mixed electrical fields. Altostratus is negative, rarely positive electric fields. Nimbostratus are negative. These are the beneficial ones. Stratocumulus is mixed. Stratus is mixed. Cumulus is negative. Now, stratocumulus or altocumulus, I guess it is. No, stratocumulus is fair weather clouds, and I got some nice pictures of that because I like to look at clouds, and I like those. I like those fields. And it goes on to tell you more about this. This is in the book, and you can read it in the book if you want. But this one is Anvil cirrus. And this one, of course, I guess is mixed. This one here is altocumulus, and this is positive probably. And this is the fair weather one, where after the rain and where everything is awash with negative ions and things feel better. So you should present the cases on these days and ask for money on these days, and and get all of those chores done on this kind of a day, because you're going to have a better response. We have in the next room over there, I don't know whether we're going to get to it, because I'm going to show you all of these things. I didn't put them all in the box just to put them away. Go see Larry Boucher over at Skilling's, and he's an exhibitor here. What I want you to really look at, I want you to look at the pulse resonators or the brain tuners, because they're very useful item in the modulation of the immune system electronically. But he also has some other devices over there, one of them which is a subliminal transmitter, where you take a positive affirmation tape, put on whatever you want on it, and you can put it in the room and play it, and that message will be transmitted to those people that are in the room subliminally. They won't know, you don't hear anything, but you'll act on what it tells you in that message. So, and you wonder how you're being manipulated, but I'm sure if they know it, a lot of other people know it too. On how to do it. There's a cumulus clouds.
You got to be careful not to believe you without.
Well, you don't have to tell anybody.
Yeah, but they find it out. You really didn't get it wrong.
Well, what they wanted, they don't even know what they went on to look
No,
at.
I'm talking about the authorities find it out.
Yeah, but they don't know what they're looking at. Go take a look at it. Altocumulus, bone situation, cumulonimbus. This is showing the negative air ionization patterns on an EEG, and it shows that they're very stabilizing. This is another thing, and this is why people like to hike up onto peaks and to prominences on hills, because this is where there's a equilibrium of electric fields, and people feel good there. This is an early. I don't think these guys knew anything about kinesiology, and they in Israel they made several interesting things. This is a dynamometer tester, where they test the finger strength with they squeeze it by placing them in electrical negative ion fields. They increase the strength, and putting them in positive ion fields, they decrease the strength. And let's see what it says. The instrument indicates that the grip strength of the hands, measuring the force of muscular contraction due to sodium, potassium, and acetylcholine reserves. The simple measurement allows the differential diagnosis of weakness and fatigue due to heat stress. The latter does not reduce the grip strength, but excessive potassium or overexposure to insecticide pollution reduces it considerably due to a lack of acetylcholine and minerals at the neuromuscular junction. But they also did ionization testing on this one too. And here's another one, another geomagnetic disturbance created by Dennis. And the patient that received this was really happy. He thought his mouth never felt so good. He had something to eat with. He says every now and then Ed gets sort of depressed because, he's a dentist. And I think that's what you get when you're a dentist. There's another interesting book, a collaboration by Koenig, Kroger, Lang, and Sonning, and the biological effects of electromagnetic, environmental electromagnetism. These are the energy units that we should be looking at in discussing what we find in the mouth with our colleagues. The current, the potential, the resistance, the induction, the energy, the power, and the capacity. Now, this came from Clinical Ecology, Marino. As with any stressor, chronic application is inimical to the organ organism's well-being and ultimately may lead to disease. Electromagnetic energy does not produce a signature disease. Rather, it is associated with an elevation of mortality or morbidity levels in the exposed population. The link with human disease has been shown in appropriately controlled epidemiological studies in which exposure was associated with cancer and suicide. When you start treating these people, the environmentally ill ones and the ones with blatant focuses, chronic abscesses, treated or untreated with root canals, these people are really neurotoxic. They are off the wall. They can't make a decision. They need help, but they could commit suicide. And you have to, be aware of that. In environment, you might want to ask them to sign a release, suicide release form. That would be interesting. Environmental electromagnetic energy from high voltage power lines, microwave ovens, radios, and TV towers, and other similar sources is pervasively present in the environment. Numerous laboratory studies with animals and human beings have shown that such energy is a biological stressor from the exposed organism. And it's also studies been done to show that it is cancer-producing, it's a cancer-inducing agent. This is a picture in Munich where they were doing behavior studies, performance studies in static electrical fields. They had it's like a Faraday cage that they had them in. You can modify the gamma globulin activities by the various frequencies put into the field. This shows a comparison of the electromagnetic fields and the Schumann resonance, I think it is. And they're similar. Electromagnetic processes of natural origin in the extremely low frequency range, the Schumann resonant oscillation, approximately 8 hertz, 7.83663, and local electrical field fluctuations 3 to 6, and local electric field fluctuations approximately 7/10 of a hertz. Electrical field during the thunderstorm, and that's the. But all of these things are affecting the human activity, because when these things are predominant in the atmosphere and the outside, they have an entrainment effect on the brain itself. That's why you're able to get these changes. One of the techniques that they use is heterodyning, or combining two frequencies of, let's say, a high number for 4,000, one say, and another one 4,010. And then you combine the two cancel out, and you end up with a 10 hertz frequency. And this is much of the what they're doing now in brain research and balancing the right and left hemispheres. But you can do this with electricity. You can do this with that brain tuner. And the benefits is you're putting electromagnetic information into the individual and asking the individual to respond, and they respond by making improvements in their physiology. This is a BioSun black background, which didn't show up too good, but this is a electrical field detector, and they have another antenna that you take off, take the other one off and put it on, and that's for magnetic fields. And I can demonstrate that after here if you want. This is another device that's useful. This is a magnetic pulse generator made by the Medtronics people in Germany, and I think that this was kind of like government issue, that they required politicians to wear these particular things. By dialing in with the 3 up and then turning it off and on, that's a Schumann resonance, has a balancing resonance. But you can take and depress yourself, or you can stimulate yourself with this thing also. And what's true? I mean, you can. and it just pulses. I think we got a couple of them around here to show you what it's like. Now, we want to go through the 10 postulates of free radical pathology and oxidative adaptation, because I want you to know about the product Antiox. Stephen Levine has also written a book on this called Antioxidant Adaptation, Its Role in Free Radical Pathology, and everyone should take a look at that, because with the antioxidants, if you have enough antioxidants at the cellular level, that cell is able to withstand more stress. So that's one way that you can positively benefit the patient, especially if you're going to ask them to withstand the stress of your surgery, or which amalgam removal is surgery of the teeth. Back. We'll forget the first one and we'll just go on. The acute and chronic hypersensitivity reactions seen in ecological illness are associated with peroxidation of membranes, followed by the release of prostaglandins and other inflammatory mediators. Now here again with the prostaglandins, we're not going to get into those today, but you want to have both. You want to have the inflammatory prostaglandins and the non-inflammatory prostaglandins, or the omega-3s. You want to have both so that the system can react in both methods. Inflammation, of course, is a natural sequela to a disease situation. The immunological sequela associated with hypersensitivity reactions may also result from oxidative damage and could be expected to resolve as the antioxidant defense system and cellular membrane integrity are restored. Oxidative stress, whether chemical, physical, or emotional in origin or arising from infection, can deplete antioxidant diseases. Xenobiotic, which are foreign compounds, can interact synergistically with foodborne compounds, can exacerbate oxidative stress. The consequences of redox imbalance can be acute or chronic inflammatory degenerative symptomatologies. Many of the nutrients which have been found to protect against environmental toxic chemicals specifically affect the antioxidant enzyme systems. Now, I get the feeling when I read medical literature in certain areas that they don't really care too much about enzymes, and especially in the field of nutrition. Nutrition that emanates from the Loma Linda or University of California. They have a few paid professors there that are advocating. There's one at Harvard too, or was at Harvard, but they advocate the use of, say, non-vital foods, and you certainly cannot obtain the enzymes that are inherently in foodstuffs. Fruits, vegetables, seeds, nuts, and grains that we eat. Mainly they're there to decompose that if it's not eaten. So you want to really only eat something that's going to rot, but you want to eat it before it does. Okay. Oh wait, we're going back that wrong way here. The primary antioxidant enzymes, superoxide dismutase and glutathione peroxidase, and many of the secondary antioxidant enzymes are inductible by substrate availability. This property may confer antioxidant adaptation against endogenic and exogenic oxidative stress. Antioxidant adaptability makes possible the temporary localized acquisition of tissue tolerance to oxidative stress. And the premier antioxidants, of course, are glutathione. The major mineral is selenium, and that should be kept in mind. The antioxidant enzyme glutathione peroxidase is a selenium-dependent enzyme. Dietary availability of selenium may regulate its adaptive response to oxidative stress. The recovery of tolerance to foods and chemicals through dietary administration of selenium may parallel the repletion of glutathione peroxidase activity. Glutathione peroxidase activity in platelets and red blood cells may be valuable indicator of oxidative stress and may find its use in the elevation of clinical response to nutritional antioxidant therapy. And as I said before, that's the front line of the defense, but we can give it supplemental nutritional aids in order to get the patient through this whole process of detoxifying and preventing damages that these metals and intoxicants, stressors will cause on their way in and out of the system. The antioxidant nutrients appear to be some of the same nutrients that the immune stimulants and anti-carcinogens, and also function in a anti-inflammatory manner. This relationship has previously gone unrecognized and represents an important concept underlying antioxidant function in biological systems. The redox action of the nutrients, particularly A, C, E, beta-carotene, selenium, and zinc, those are the ones we give for pre-surgery stress, and this has been known for quite some time, may be the very function which elicits beneficial effects on inflammation and immunity in vivo and in cancer prevention. But those are the premier ones. During inflammatory prostaglandin production, oxidants are generated. Antioxidant compounds appear to inhibit the production of pro-inflammatory prostaglandins, some of which have immune suppressive effects which may contribute to the immune dysfunction seen in ecologically ill patients. Let's see. Chronic infections such as Candida albicans. Let's see. I can't read what it says there.
Yeast.
It says yeast, yeah, but I'm talking about, let's see, free radical mediated oxidative stress in the body, in part by stimulating the production of inflammatory prostaglandins, which tend to suppress immunity. Selenium deficiency may selectively limit the ability of phagocytes to destroy Candida. Selenium deficiency may selectively limit the ability of phagocytes to destroy Candida. The immune suppression and resultant susceptibility to yeast infection seen in chemically hypersensitive patients may improve with treatment utilizing antioxidant nutrients in conjunction with immune stimulation therapy. And we're going to go into that immune stimulation therapy in a little bit using electrical methods. Emotional stress is likely to contribute to oxidative stress in the body due to the tendency of the catechol hormones, epinephrine and norepinephrine, to become oxidized to radical derivatives able to precipitate physiologic damage. Here we have a biochemical mechanism with which to understand how emotional stress contributes to immune suppression and biological degeneration. Oh my God, I forgot all about that. Well, the thing is all cooked here. In fact, it's kind of overcooked, but we'll let it cool off because that's boiling hot right now. I'll just make a short report. One of them's black and the other's still clear.
Well, it turned all black, and then the black all went to the top.
Yeah. But well,
Now it went back down again.
and that went back down again. I wasn't watching it. I was reading this here. I apologize for having to read this, but I don't have all these minutes of memory. And you really want to go to each one what he says, because these postulates were thought up and they make a lot of sense and they're useful for us to utilize. Emotional stress is likely to contribute to oxidative stress in the body due to the tendency of the, I already read that, and immunosuppression and biological degeneration. Okay, this is the last one. The free radical pathology which underlies ecological illness is likely also to play a primary role in the development of metastatic spread of many cancers, as well as in cardiovascular diseases, emphysema, arthritis, burn injury, cataract, cirrhosis, and diabetes. Oxidant damage in these diseases, disease may be signaled by significant increases in circulating lipid peroxides, Many inflammatory degenerative diseases may be manifestations of abnormal redox phenomena. Now we're going to learn a little bit about redox when Dr. Kramer talks about the bioelectric Vincent method of analyzing urine, saliva, and blood. Now, we had planned a seminar in February where Dr. Sandy Beto, who is a student at Kara Reams, was going to talk to us about biological ionization, where he goes into pH resistivity. They do the conductivity of the fluids and the redox potential, plus there's a couple of other factors that they use that the Germans do not use, or the Europeans, the French do not use. But these areas we have to look at because they give us a very positive parameter of things that are very useful for determining where the patient is in the spectrum of health. Let's see, redox phenomena, and therefore preventable or treatable using nutrient-derived redox-altering antioxidant modalities, which are generally of low toxicity. These modalities may approach a very primary cause of pathology rather than providing really symptomatic relief. And that's looking from a biochemist's cellular viewpoint, but he's got a good point there. This is his product, and we use this one in our detox program. I'll go through that in just a little bit. These are some of the things that he has in it, and this is a good formula and a good product, and they're here to answer your questions. They have several new products. They have, okay, you want to change that slide tray, and I'm going to get a drink of water.
Where's your other?
It's right there. Any questions about this?
Something you want some warm water.
Don't go over and touch that. That's really hot. You can just lift it up that way unless the top's going to come off. The top come off? I don't know. This is the water that they're serving you here at the hotel.
Put it in the light. There, right there.
This is the water they're serving you at the hotel. Okay? You're drinking that. You know, people say, geez, why do you drink wine at lunchtime? I says, I'd rather have the grape filter that the vineyard can't possibly pollute the water like this is. And you watch me, I don't drink any of that stuff. Now this one here is the distilled water, and the only thing, and then we had a rusty electrode in there, but a little oxide will come off. There's a little oxide in that too. Those were new electrodes in that one. And this is the other one. Now, which one would you rather drink? Either one, that's right. No, this is just to demonstrate the...
Was that multiple choice or true false?
For what?
Answer your question. I'll drink the water. Which one do you want to drink?
Are all of the above. No, the reason why I did this is I wanted to show you that this is a real problem. This is the biggest problem we have besides the funny money we got. But we won't get into that, because that's even a worse problem. Okay, let's go to the next one. That's your tray, the other tray, Gary. That's me. You want me to give you your lecture over again?
Let's see him.
No, that's good. That's it. What time's it now?
10:05.
Okay, we'll zip through this one. During the past few years, it has been increasingly realize that nutrition also plays a major factor affecting the toxicity of chemicals. The quality of nutrition may profoundly affect the toxicity of chemicals. The nutritional status of individuals may result in increased or decreased susceptibilities to chemicals found in food, administered as drugs, or present in the natural or work environment. And it's true. That's how we get our supply of antioxidants, nutrients, substances that become us and that we become. I have some pictures at home, and I didn't even think about putting them in here, of the guy that did those paintings. I'm just Archimbaldo. Anybody know that? Archimbaldo. He did these pictures of people, and they were composed of nuts or vegetables or whatever, and they, they had hair and all vegetables and stuff, and they were very, very interesting. And that's what we are. We are composed of those nutritional substances we call food. After it takes a break apart and comes back together again, metamorphosizing in our particular pattern. This is from Lawrence Basley's book. He was going to talk last February, and we didn't have him. But you can see how you can take and modulate the immune system with vitamins and minerals. And I guess this is important when some people are looking at a particular aspect of this, whether they want the lymphocytes up or down, or want the antibody production up or down, by taking and elevating or depressing certain counts of B6 pantothenic acid, B2 folic, CA, fats, cholesterol, iron, zinc, magnesium, selenium, cadmium, lead, or mercury. You can make it go up or down. That's in his book, and hopefully his book will be here for sale. Somebody forgot to send down a box of them, and you might want to pick that up. It's a paperback, and it's called Lawrence Basley's Treating AIDS Naturally. He's got a lot of good information in there, and he's got another book called Energy Medicine, but it's just out of print right now, and we will have that available from time to time. The course of nature is the art of God. Now, this is what we're trying to do, and the way that we should do this, of course, is to grow up our progeny free of all the defects and without any of that amalgam or all that stuff that we have to worry and contend about, fight lawsuits about out at this level. We got to go back there, and hopefully biological dentistry will help make that turnaround with a new consciousness sometime in the future. This is an old slide that I had, and all disease is a socially created reality by Ivan Illich, and it really is. And then to become healthy, like we were talking about at lunchtime, you have to engage in antisocial behavior, because society is getting sick, and they're getting sicker because of the way that our disease has been institutionalized, and the way that our disease treating systems have been evolved and set up. They're all economically oriented. The health of the person is just some commodity to be exploited. This is a picture of the Sistine palate. When God said that the palate should be pristine, I thought he said Sistine, and so I made them that way, but I think I'd much rather have this mouth than this one, even though this was not a bad result for a country dentist. This leads us to the principles of optimal organic nutrition, which I put on paper about 17 years ago, and I got some in my bag over there, and I'm going to get them just a minute past now. So we can skip all this part, you can just read it. There we get this one. There's a couple with pictures, so those up in front, you get the ones with the pictures, and the others, ones get it printed. Get the printed page. And those are the principles of optimum organic nutrition. And if you follow these things, you don't need all of the supplements, and you don't need the homeopathics, because you're not going to be getting sick. And in any kind of disease situation, the primary thing to do, the first thing to do, is you got to quit doing that which is making you sick. In order to get well, you got to quit doing that which is making you sick. Now, of course, that's kind of hard with all the obfuscation and ignorance around. It's kind of hard sometimes to find out what to do. But Hippocrates had a pretty good handle on it, and he said, let food be your medicine and medicine be your food. Let's see what I say. He also said something else here. He says, foods must be in the condition which they are found in nature, or at least in a condition as close as possible as that found in nature. And what you want to do is you want to eat fruit, vegetables, seeds, and nuts and grains as close to their natural state as possible, hopefully 75% or more raw. Now, I don't do this. I try to. I have in the past. I experimented with my diet. I went from the 255 down to 180. I got so spaced out that I couldn't function at this level. And if I pursue that, I would end up becoming a saint. And I'm telling the truth about it. So I decided, well, to go back to where I am and to maybe help some other people understand this problem. Because we find out a little bit in our talk on electricity is that you really don't even need food. But you might possibly be able, just like Teresa Newman and other saints have derived their sustenance from the sun energy, from the alpha energy of the sun. And this is a phenomenon that's pretty well known. Those are the grains that we should partake of, a broad range of nuts and grains, seeds. This is Carol and I in the Corona Grossa in Italy. Has anyone ever been there? And if you travel throughout Europe with Peter, of course you know where all the great restaurants are. He was on a plane to South Africa one time, and some guy sat down and next to him, the guy like he was, and they're talking about good restaurants. And so Peter, this guy was describing to Peter this restaurant here, the Corona Grossa, and Peter knew which one it was because he told him what town it was in. And he's so impressed, the guy couldn't believe that somebody didn't know, would know about this restaurant. You go into this town and they have these old medieval, it's like medieval Italian buildings in Saluzzo, Italy, and you would never suspect it was a restaurant there. And you go up the second floor and they got this beautiful place in there that serves this wonderful food. And so that's it. One of the things that the food should have is they should be based on this biotic pyramid with the soil, the microbes, the plant life, the insects, the birds, the herbivores, omnivores, carnivores, and man at the top of it. And the food should be grown on organic soils. And there's a big movement in the United States to get back to doing this, and throughout the world. And I don't know how much headway they're making, but they have a magazine called Acres, and they're trying to get back to more biological method of food production, because food is really important for our maintenance of our health, and we have to gain control back of this. And what had happened in the last 8 years or so with the consolidation of the ownerships of the farms into the banks and the oil companies, this has been a bad move, because they're only going to continue to use the disease-producing methods, the deficiency-producing methods of their agribusiness agriculture. Gary says this is one of his favorite things. He made one of these up for me at his house. And he says, he was sorry he didn't have any pork. But he put some Spam in there to make me feel better. This is the coffin they buried the tooth in.
Hey, Ed, I forgot. After you got done eating, did you eat the maraschino cherry or not?
No, I never eat that red number 4. I don't want any part of it. I know that causes cancer. Okay. As part of a good diet, you want to avoid certain things. You want to. Now here again, I'm telling you what should be done, and whether I do it or not is another story. But there had been a time in my life where I'd smoke cigars, which I don't do anymore. But I still have a little sherry on occasion, and these are the remnants of the Last Supper. You have to abstain from sugar, alcohol, drugs, tobacco, and in all forms. And this is really an important part to maintaining your health. Once you get on the drug train, whether it's the commercial drugs or the street corner kind, you're in trouble. And because it's a one-way ticket to ill health. This is a nice shot of a bunch of teeth. And these are the kind of things we want to avoid.
How to boil that in your water.
There is now an extensive literature indicating that drugs may impair the absorption of nutrients or increase requirements by affecting pathways of intermediate metabolism. There's a good book out by Daphne Rowe on drug-induced nutritional deficiencies. If you ever want to read that, I didn't put any of her quotations in here, but it's a good book, and that goes into the problem quite extensively. As the drug metabolizing enzymes have normal physiological functions, the effects of nutritional deficiencies on these enzymes may also affect physiological processes, resulting in disease states. Furthermore, the increased load on these enzymes occasioned by the prolonged administration of drugs will make increased demands on nutrition. Symptoms commonly associated with low-level chemical contamination include headaches, fatigue, impaired memory, mental activity, emotional instability, blurred vision, poor coordination, and skin abnormalities. Well, you can get all those from metals, too, in the mouth. Okay, now, one of the things that we do use in our detox regimen, and I'm going to start to get into that now, is we like to certainly emphasize all the sulfur-containing vegetables, and we also recommend the use of eggs because of the sulfur-containing amino acids, cysteine, and also methionine. We use kelp, we use dulse, seaweed, kelp. This has a particular affinity for heavy metals. Alginate has a particular affinity for heavy metals, and will absorb metals out of the intestinal tract. We also use, I got that written down there too, I think, so on the list. Not on that list, but on another one, which I didn't bring in, sorry. But we'll have that list printed up. We're revising it now for a new regimen that includes a few more things and a modification of some of the older things we did. But we use also the pulpy white part of citrus fruits, the inside of the part of it. We recommend people eat that because that has an affinity for heavy metals also. As I said, we have meat, garlic and onions, and sulfur-containing vegetables, so broccoli, cabbage, cauliflower, sprouts, beans, and legumes, lentils, that kind of thing. And of course we use garlic, and we use the chaolic form or the SPG form. Heavy metal poisoning is difficult to treat. Chelation treatment is the only known medical treatment that is effective in detoxifying the body of heavy metals. Now, the Japanese study conducted by doctors Ikizoi and Kitahara show that chaolic, a raw garlic extract developed in Japan, is effective in protecting the body from the toxic effects of heavy metal poisoning. Dr. Kitahara and his co-workers, Ikizoi and Yamada, conducted controlled studies on rabbits and humans. The method of study was observation of released potassium, hemoglobin by heavy metals from erythrocytes, and destruction of erythrocyte membrane. The conclusion of the study was that garlic preparation prevented the poisoning effect arising from heavy metals and protected the erythrocyte membrane from destruction. So, In another study conducted in Russia, a drug made from garlic extract was given to workers in industrial plants who were suffering from chronic lead poisoning. The daily doses of garlic improved the symptoms of chronic lead poisoning and lowered the high porphyrin levels in the urine. I think that's one of those high levels in the system, of course, is one form of schizophrenia, I think. The preparation was normalized in elevated blood pressure in the majority of workers. Russian researchers believe that the efficiency of the garlic preparations is due to garlic's high content of sulfur compounds and also germanium and selenium. As we know a little bit more, this is what we use. This is Kurta, and there's a resemblance to Fritz there. They got that long, I guess it's Bavarian nose, I don't know if it's a Franklin nose. But the quote that I always like to use with him is, I like to say, to look at rows of bright teeth without envy, this is the greatest trial of mine. And I guess he had bad teeth, so it might have been like George Washington. There's a picture of that Spanish miner being used in the sauna. Now we use baths. Our detox regime formally goes for about 6 months. What we like to do is we alternate baths on days. We do day number 1, we do a chaparral bath. Now chaparral is an herb, an American Indian kind of cleansing herb. Its active ingredients is called nordihydroxyglutaric acid, and this particular substance has the ability to inhibit anaerobic glycolysis and aerobic glycolysis also, but more anaerobic glycolysis. Therefore, it's useful in curing cancers. And you can use it in 2 ways. You can make a tea out of it, or an infusion, or you can grind it up, put it in gelatinous capsules, or you can take, as we're using it here, to just reduce the stress load of whatever stressors are going to come out of the skin in a hot bath. It'll neutralize those stressors. We do that on day 1. They take a bath as warm as they can handle it. They take a tea bag with a handful of this, not a tea bag, but an old stocking, put the ground up chaparral in there and put it in the tub and make a tea out of it, and they jump in it. And they sit in there and soak for half an hour. And then the next day, meanwhile, they're also taking their homeopathics that we prescribe for them. And I use Mercurus Heal. We use Oban Metals and Dentals. And we also have used and still use on occasion, Hazel Parcells Master Metallics formula and Special Mercury formula. We use all of those in conjunction with the diet. Now, we try to get them to follow a good biological diet as described in the papers that we handed out here. The second day on the bath regimen, we're going to go for 9 days on this. The second day we do a Clorox bath. We had started out with a cupful of Clorox to a tub of water, but that's way too free radical promoting. And what we do is we have to put a capful of Clorox in the water, and even a half a capful is all right too, because what you're doing is neutralizing the toxins that come out of their body so they don't re-enter. That's how you're utilizing this. The body is an open system, and it absorbs back, 15-20%, and it's back and forth. And we are in this environment, open to it, and we are modified by the environment. What we're teaching you here, and this is a word that Gary coined, one of our first program for American biology here was American Academy of Biology. He had dental ecology written on the thing, and I thought that was a rather good word, and I used it on the cover of the journal there. Bioecological dental medicine. We modified it just a little bit. So that's on the second day. You take the Clorox bath. Now on the third day, we recommend the sauna. Now there's a lot of things that can be done. You can You can give them niacinamide. To increase the excretion of metals, you can give selenocysteine. You can increase the glutathione. You can increase the antioxidants. You can increase the B6. This will all help it. One of the things that we're working on now with a biochemist is we made some formulas of some things, and then we want to replace the good metals. So you have a good metal preparation, a good mineral preparation to replace those lost in the sweating and the excretion of the heavier ones. See, now we're in the sauna on the third day, and then they repeat that another cycle and another cycle. That's 9 days, and they stop. All the time while they're doing this, they're taking their homeopathics that we prescribe for them. Then the next month, they eat a good biological diet and drink good water, and try not to re-intoxicate themselves. No booze, no cigarettes, no drugs, no alcohol, no poppers, none of that stuff. And then what they do is they repeat that. That's 1 month. That's a little over a month. Then they go for another 9-day period and another month of good diet. All the time it's always a good diet. But they repeat that 6 times. And at the end of that time, we do this after we have completed the removal of their toxic restorations. And we're trying to put more gold, and we're trying to put composite in there, especially on molars, because you really want to have some strength in there. And you'll find out that some people that tested poorly to the gold, as you get them cleaned up, they'll start to test okay. They can tolerate more stuff, and that's an important thing. This is the chaparral. We buy it in 50-pound bags, and it works. And we've isolated the active ingredient. We're going to put it in tablet form and start using it. There's a lot of others. It has a phenolic antioxidant in there that I think is probably going to be pretty good for people with phenolic-induced allergies, hydrocarbon ones. And of course, we use vitamin C. This has the ability to chelate with all the heavy metals. Cadmium, that's it. We also use one charcoal capsule when we're taking the whenever we're removing mercury fillings. We take and give the patient one of those, and we try to cover them up. We use a rubber dam and a double suction, and this is to prevent them from ingesting any of that stuff, or at least if they ingest it, it's not going to be too toxic for them. It'll be absorbed by that. These are the Oban metals and dentals, and we use the bacteria, depending on the patient. And then we also use the heal preparations in much the same way that Gary uses them, and we'll work on the organs of detoxification, the liver and the skin, and we also make sure that the lymph is moving. When you have pain anywhere, if you can get the lymph flowing, you can eliminate the pain. And we recommend that they go to get massages and do some slight kind of activity, especially post-surgically, not immediately after, but after that first week, so that they can get back to health. We also recommend that they use moist hot compresses to increase the circulation. Some of the things that we've been doing now, we're going to get into, I think it's coming up here, are the use of the electricity in modulating the immune system. This one, let me just read this here. There is now an extensive literature indicating that drugs may impart the absorption of nutrients or increase requirements by affecting pathways of intermediate metabolism. Well, we know that because the Krebs cycle, citric acid cycle, these are all out of whack. And that's how useful that armamentarium from Heal. As you read this book, it will explain to you many of the things. Reckwick was by far and away a bona fide genius who had a tap on somewhere. where how he came up with all these things. He was not only a scholar, I never met him, but he came to live in the United States and founded the Biological Homeopathic Industries, which is BHI. And they have, he evidently had owned a heel company, but he sold a heel company, and he came here, and he started out again as I would not say an adult, but he was like 70 years old or so when he came over, or maybe a little older even. And he started BHI, and one of the unique things about the BHI products is it has the no-sode and the remedies from the plant, vegetable, and mineral kingdom all in the one item. So it's a very effective form of kind of generic treatment. In other words, rather than being specific, if you have a problem with an allergy and you're not going to see the patient, you just give them that, and that will probably afford some relief for them. So this book is a landmark book called New Frontiers in Transcutaneous Electrical Nerve Stimulation, and Jim Jost has some of these for sale out there. Much of the material, I'd have to say almost all the material that's in this next section is come from this book. And I don't know what the Germans are doing in this line, whether they're using electricity to modulate the immune system, but you'll see from the scope and breadth of this thing that it's here and it works, and there doesn't seem to be any downside. There has to be, but we haven't found it yet. This one is just a mild pulse stimulator, much like the myotronic ones that we used back for the TMJ work for registrations. And this is a surge resonator, which is a Skilling product. It has about 300 bass frequencies, and the harmonics of all those frequencies. It literally has tens of millions of frequencies. And the way that they say that this thing works is that every cell has its own resonant frequency, and that these frequencies that are impulsed into the individual find a resonance with that cell, and when they resonate with the cell corrects itself, because that's its base frequency, that base energy, and it does whatever required to do it. Whether it gets rid of stuff or adds stuff, whatever it does something. And that's one theory on how the thing works. But as I said, this particular unit, these are not FDA approved and for experimental use only, but people that have been very, very ill find these to give them relief. It gives them help. They can function. They can get around. We use it pre and post-surgical. Okay. This is another application. The pads you can take and put them in 2 separate foot pads. It's not a new thing. These things were reported in the literature back in the late 1900s, and as I said, that this thing derived from much of the work that happened in Hong Kong. They made these black boxes, and Meg Patterson took it back to England, and she did all the drug detox work with these rock stars, and she's the one that treated Boy George and Keith Richards and all these people, and brought them back. Some of them were virtually near dying with just a device like this. And so it has a wide range of capabilities. One of the things that it does do is it reduces stress. And you can use this, they use it for addictions, and that's basically why people become addicted, because they want to feel better. They don't feel good. And when you increase the opioids, the endogenous opioids in the body, the patient feels better. And when the patient feels better, they don't worry about a lot of things. They may still have the problems, but they're feeling better. And as you'll see, we'll get into this, but that's basically how it works. It's used for the treatment of addictions in certain circles, but it has a far greater range of capabilities that we haven't even tested yet. This is one of the old ones we used to use as a little TENS unit to relieve pain. Here's the MPG. We saw that. Here you can dial the 1 to 3 hertz to counteract inflammation, 4 to 6 hertz for mental irritation and cramps, and 10 to 14 hertz for migraines and serotonin complaints. It's interesting to note that those people in Israel had made a machine very much like the pulse resonator, and about the same kind of frequency range, the same kind of pulse range, and they were using it to counteract the effect of positive ionization, but it was an electrical device. When a dentist looks at this mouth, he sees a mouth that's an average mouth, but this is a very sick mouth. There's a lot of problems with this mouth, and the dentists have to be made to realize that this is not what we want to see. And we don't want to see this either.
What's left?
Yeah. Attends an hypothesis for electrical neural immodulation. Clinical observations on the effect of mood and emotions on disease date back to Gale. But recent quantifiable observations have been made of the effects of acupuncture, hypnosis, faith healing, stress, and classical Pavlovian conditioning on disease. These observations establish that although the leukocytes, antibodies, and other immune systems can function independently from the nervous system controls, coordinates, and modulates their response. Electroacupuncture has been found to affect neutrophilic blood counts and the measurable phagocytic activity of neutrophils. Other immune responses in which neural control has been demonstrated include the vascular response to injury, antibody formation, cell-mediated cytotoxicity, humoral responses, leukocyte migration, and anti-tumor natural killer cell lymphocyte response. Electrotherapy has a potential to modify all of these factors of the immune system. When we were talking to the people at HEAL, and I recommend you go to their seminars, they're putting on one-night things around the country. Go listen to what they have to say. But when we first met them, we were talking about the potential uses of electricity, and they felt that maybe in the future, not in the near future, but in 20, 30 years down the line, that maybe their company wouldn't be in existence exactly the way it is today. And because of the vista of electricity and electronics coming into the treatment of disease. And there's a lot of people working on this particular thing. These are the units that we have to think in biological responsiveness. When we get down to the micro unit, or which now is called it's not called micro anymore. What's it? Anyway, the pico and the nano unit. These are the units that are effective in the biological range. The higher ones also, but the more effective ones respond in these particular vicinities. In other words, it's like you could pass. We did that physics experiment where you pass 1,000,000 volts over the guy with the Van de Graaff generator or the Tesla coil or whatever it was, and you see the hair stands up and it turns blue and everything, and 1,000,000 volts goes through them. Where now the body didn't respond to that at all. It may have responded. We never measured them, but if you take and put information in the nanowatt range, it's listening to you, and it responds to it. That's what the cover of our journal is about. This is a biocybernetic exchange. We're asking the body for information, and it comes back with information, and that tells us how to treat it. Right now, it's a skin-resistant measurement device that we're using, but Ralf doesn't use that very often. He uses his hand, and he uses the pulse. It's like the Chinese use the pulse, and they ask the questions. They bring the thing into the field, and when the field changes, the response to the pulse, and then it's quick, they diagnose it from that. And he's going to show us that. And We also have on the book table there 3 chapters out of Auger's book that we've copied, and so that you can learn how to do that even if you don't hear Ralph talk about it. The effect of electrical stimulation on neutrophils. Phagocytic activity as well as cell numbers increases with electrical stimulation. So if you wanted to clean up a mess, what do? Get them off of sugar and put them on the brain tumor. It's a way to go. It's beneficial. The effect of electrical stimulation on neutrophils. Leukocyte migration is also responsive to electrical control. Tenor found that leukocytes in infections migrate toward the negative electrode. Fukushima and Manguyo found that neutrophils migrate toward both anode and cathode. Electrical stimulation has had stimulating effects on the phagocyte blood cells as well as on the microvascular circulation. Wang et al. Studied the effects of electroacupuncture on the blood cells of rabbits. They found that the overall leukocyte count increased by a factor of 2 within 3 hours of treatment. Neutrophils increased fourfold. Gratiam and Toma carried out similar experiments in humans. They found 55% increase in phagocytic activity after acupuncture treatment. And it's true that. And well, people want to know how acupuncture works. Well, there's some theories that believe that when they put the needles in, the needles are acting as a tenet that they can be the orgone or the natural resonant electrical energy that's present in the atmosphere, which is in the trillions of volts. It's an electrodynamic electrical thing, and it picks up just enough to circulate that energy. And you can, if you ever had acupuncture treatment, you can feel that energy circulating in your body. You can feel it. Effects of electrical stimulation on antibody formation. Observations have tied electrical stimulation of the nervous system with therapeutic effects on antibody formation. Korneva and K.I. electrically stimulated the posterior ventral hypothalamus and found that enhanced levels of antibody had been produced. Fess and Forst, I guess, also found that chronic electrical stimulation of the lateral and dorsal medial hypothalamus induced elevations in the level of circulating gamma globulin antibodies. Okay, now, immunologists would be excited about that. Maybe you're not, but I know that they are. This is a big breakthrough through them. I had the immunologist that we work with. One of the patients went back to him and told him what I was doing and helping this patient get along after their surgery. And the guy had been, he said, 40 to 60% better than he'd ever been in his adult life ever since he became sick. And the immunologist really wanted to know what I was doing, so I sent him this book, and I sent him this, and I sent him photocopies. I haven't heard from him because I don't think he's read it yet, But it's just too much to ask somebody to go out of their routine to look at this, So maybe I think that he will read it. It's just a matter of time. Long-term studies were done on the effects of low-voltage electric stimulation on antibody formation. Although such stressors as noise, light, and crowded housing conditions could suppress the primary and secondary antibody response, repeated low-voltage electric shock was found to enhance antibody responses. More recent studies have tended to show that acute exposure to stressors may suppress the humoral immune response and that repeated exposure to stressors result in adaptation with an enhanced immune response. And the neurophysiology of chronic pain. Chronic pain differs from acute pain in that the body and the nervous system have been physically altered from the continuing effects of the pain. Even though the original cause of the pain may be long removed, the pain lingers on. The patient's lifestyle can be permanently altered as well, as the patient's life comes which would be controlled more and more by the ravages of protracted pain. And we all encounter that every day. Neurotransmitters, sodium and potassium ion channel molecules and neurotransmitter receptor sites are normally produced in the cell body, located in the dorsal ganglia. That's a soma. Much like a factory on a side street, the cell body then uses a process which requires the expenditure of chemical energy, ATP, to transport these molecules down the branch axon to the point where it branches and the molecules enter the main thoroughfare of the nerve fiber. Some TENS wave patterns are believed to work by activating the internal release of endorphins and enkephalons, the body's own natural and internal opioids. These opioids may be involved in the regulation of pain, pleasure, learning, fear, stress, and spine-tingling goosebump thrills. If the pain returns after naloxone is given to the patient who has been relieved of pain by acupuncture, TENS modulation, or a placebo, then one might conclude that these modalities work by inducing the internal release of opiates. Another TENS modality was developed specifically for the head and neck area and is called the alpha stim. This waveform is a very biphasic rectangular wave in the microamperage range with a frequency of between half and 8 hertz. It goes up to 320 hertz. Success in the treatment of pain secondary to carcinoma of the head and neck was reported where more conventional TENS therapy had failed. Electrodes were placed over the area of pain, and the waveform was set at a half hertz for 500 microamps for 2 minutes. This waveform has been used in the treatment of tinnitus and in optical neuritis and multiple sclerosis. And that's the one where they're lateral sclerosis too. The low-level wave, transcranial TENS, using extreme frequencies from a half hertz to 15,000 hertz, significantly modulates neurotransmitters. These effects may result in the therapeutic modalities for various clinical disorders and need further clinical evaluation. But they're saying that you can use this stuff. This may be old hat to some people, but it's new to me. Immune-enhancing effects of hypothalamic stimulation may be possible through non-invasive means such as inferential currents or radio frequency currents modulated in the EEG frequency range. Spector and Corneva report statistically definable impulse frequencies at 8.64 impulses per second in the zona, somebody's head's in the way there. The zona incerta area at 5.79 impulses per second in the dorsal medial nucleus of the hypothalamus. T lymphocyte function. This area of transcranial TENS research has the potential of giving scientific rationale for a variety of TENS parameters to modify and to treat a wide spectrum of disease which have a common denominator, a pathological disruption of the immune system. The autonomic nervous control of T lymphocyte function. The work of Devanovich and Norton is especially relevant here. They've been able to alter cellular cyclic AMP and cyclic GMP ratios by proper choice of electrical field parameters. This induced electrical field could shift the immune system toward cyclic GMP if enhanced immune proliferation is needed. It could shift toward cyclic AMP if enhanced immune proliferation is needed. Isn't that the same word? Yeah. Oh, it could do either. It could shift toward cyclic AMP if leukemia is flooding the circulation with immature cells. When myelotic leukemia cells are induced to differentiate, they also stop proliferating. In other words, they can stop leukemia. Other malignant cell lines have also been induced to differentiate and stop proliferating. These include erythroleukemic cells and tetracarcinomas. This is theoretically important because a proliferating malignant tissue induced to differentiate by electrical stimulation would be rendered non-malignant. This thing is useful in cancer. So, got to look at it. Autonomic nervous controller T lymphocyte function. This sympathetic innervation allows the transmitter, often a biogenic mean, to be diffused to a large number of lymphocytes. The transmitter substances are not limited to traditional acetylcholine and norepinephrine, nor adrenergic, non-cholinergic transmitters in the sympathetic nervous system include adenosine triphosphate, somatostatin, a vasoactive intestinal peptide, and enkephalons. In the parasympathetic nervous system, substance P, VIP, enkephalons, somatostatin, cholecystokinin, and thyroid hormone-releasing hormones serve as neurotransmitters. Often several neurotransmitters may be released from a single nerve. And when you have mercury, this all stops. Inhibition, total inhibition. Numbness. Anatomic nervous control of T lymphocyte function. Some of the cyclic AMP antagonists, which tends to promote lymphocyte cellular differentiation, include adenosine, beta-adrenergic agents, cholera toxin, corticosteroids, growth hormones, histamine, parathyroid hormone, prostaglandins, thymic humoral factors, and vasopressin, cyclic GMP antagonists, which tends to promote lymphocyte cellular proliferation, include ascorbic acid, muscarinic, cholinergic agents, hydroperoxy fatty acids, imidazole, in the interleukin-1, mitogen, serotonin, thymopoietin, GTP, endoperoxides, thymosin, virus transformation, and xanthine derivatives. When I'm painting your picture, how useful, how broad, how wide this thing is, try it, you'll like it. Go visit them. Get a unit. I know a lot of you bought them the last seminar we had, but maybe they're just sitting home in a drawer like a lot of dental stuff. Get it and use it. Use it on yourself. See what it does for you. Components of the sympathetic innervation both enhance and suppress the immune response, which is what it should be. Lymphocytes have receptors for a wide variety of neurotransmitters, hormones, and mediators. Internally, increases the cellular cyclic GMP, promote clonal proliferation, enhance function of mature differentiated lymphocytes. Increases in cellular cyclic AMP, promote differentiation of immature lymphocytes. Many neurotransmitters will have opposing effects on lymphocytes. Bullock and others have demonstrated an immense system of sympathetic innervation throughout the lymphoid tissue. The nerve endings are modified with extensive arborization and viscosities resembling beads on a string. I had a picture of that to show you that. One roll of film didn't turn out, so we'll skip through that. Chloroplasts are placed in a 220 volt electrical field to see if a protonicity current, which is a current of protons, induced to flow across that thiacol membrane. That's a membrane in the chloroplast of a plant. Would cause the membrane's ATPase pump to generate ATP as predicted by Mitchell's theory of chemosmotic bioenergetics. 6.5 moles of ATP were produced for each ATP molecule per pulse, with 10 pulses of 30 milliseconds each. It's producing energy for the cell. We can produce energy for the cell by utilizing this method for your cells. If you got somebody with a vegetative dystonia, or you have somebody that doesn't measure 80, hook them up. They'll utilize some of that energy. 2 or more high-frequency currents of slightly different frequencies that produce a low-frequency current be equal to their frequency differences. For example, 4,000 Hz and 4,004 Hz might produce a selective basic stimulation of a particular area of the hypothalamus by tuning to its particular characteristic resonant frequency to take advantage of the immune-enhancing effects that it may produce. I would certainly like to have a chart of all that, and I know there are people throughout the world working on these frequencies, but we only want to deal with the Hertzian ones and not the ones that are radionically derived by somebody looking at the sky and a pendulum or something comes up with a number. Now, I've seen those work, so I can't poo-poo them, but we want to keep it, at least in this particular
reality.
ACTH is also released from the pituitary during electrical stimulation. It originates from the same precursor molecule as beta-endorphin and melanocyte-stimulating hormone. They are released jointly from the pituitary. An increase was found in human cortisol and urinary 17-OH corticosterone occur in response to acupuncture. Lau has verified these findings in rabbits. Increases in corticosterone at physiological levels actually enhance the immune response. That's, we were talking at lunchtime about adrenal deficiency, and everyone with these allergies and people, they all have adrenal deficiency, but you want to treat them, but you want to physiologically stimulate their adrenals. You don't want to overdo it. You don't want to give them a shot of cortisone to pump them up, only have to come crashing back down again. Only at much greater pharmacological doses does corticosterone become immunosuppressive. That's what it does. Goes back into the, crosses the biological caesura and back into the regressive, the progressive vicariation on the homotoxicology chart in this book here. And this book is a condensed version of a bigger one that's in German. And we're waiting for them to publish that. Gary read it and he can tell me about it. These observations on bioenergetics were extended by studying the effects of electrical stimulation on isolated rat skin in vitro with strips of skin 3 to 5 millimeters wide, 5 millimeters thick. They discovered that the direct electrical currents ranging from 10 to 1,000 microamps increase ATP concentrations in the tissue by 3 to 5 times. These currents also stimulate the incorporation of amino acids into skin proteins. Amino acid transport is best stimulated between 75 and 100 microamps. Sometimes we are accused of going too fast, and sometimes we go too fast. Now, I think that maybe we went a little fast today, but he's the one that goes fastest of all. He's the one that the police know. Actually, this is a picture of him trying to bribe the cop. He was telling him we could pay you right here.
That is him.
Don't you like that red light? It's beautiful. But he didn't talk him out of it. We had to pay him. Some of the neural systems involved in neuroimmunology may be related to those invoked during the relaxation response. Has discovered the relaxation response by electrical stimulation of the anterior hypothalamus. He contrasted it with the fight or flight response discovered earlier by Cannon. Kempson and O'Hara have shown that transcranial electrotherapy in low-level currents and frequencies is an effective means of inducing the relaxation response. Keekolt and Glaser et al. Have found that over a 3-week period, the use of the relaxation response more than doubled the NK cell, natural killer cell activity. Interferon enhances NK activity in a number of ways. Interferon recruits pre-NK cells into cytotoxic activity and inhibits suppressor T lymphocytes capable of subduing the NK-mediated cytotoxicity. NK cells are in contact with tumor cells secrete interferon so that the NK system serves as a positive feedback internal amplification loop. Now, the herpes virus antibody titer also declined with the systemic use of relaxation response. Much recent research suggests that the right hemisphere specializes in processing negative emotions, while the left hemisphere specializes in positive emotions. Selective stimulation of this area by transcutaneous electrical therapy may be expected to produce significant changes in immune response. There's a guy down in Texas working on a book on chanting and the immune system. And it's been shown that chants can modulate the immune response to a better state of balance, which is a rather interesting thing. There are a group of people in the United States that are utilizing sound as a healing therapy. One of the things that really impressed me when I was learning about this, we took Gary and I took a course from Andreas Marks, who were down in Los Angeles, and Andreas had one of the chiropractors or some guy there, and they were measuring them, and they had one meridian was all out of balance. It was in high inflammation. He had an 85 or 90, something like that, 87. And Andreas went in, oh, like this, and this directed the sound at him, and the needle, while I was still on the thing, the needle just went right up to balance. And I couldn't believe that, but I knew that the sound was very important. Now, I don't know whether it's the sound or they don't know whether it's electricity or the electromagnetic fields that are induced when you have if you have electricity and it's moving in a field, you produce electromagnetics. If you have electromagnetics moving in a field, you produce electricity. So it could be one or the other. Kay and Morley found that both beta and alpha endorphin and beta lipotrophin enhance human peripheral blood lymphocyte natural killer activity at the rate of 3 to 5 times more efficiently than fluencaphalon and metendorphin. They also observed that naloxone reversed the enhancement of lymphocyte natural killer function produced by human fibroblast interferon. This may suggest that circulating levels of opioid peptides play a role in NK regulation, and this is occurring in the intracellular matrix, the internal milieu. The neurohumoral effect of the immune system is supported by a great deal of evidence, since TENS is, in a variety of forms, is known to significantly alter and modulate the peripheral nerve system and the central nervous system. It seems reasonable and logical that there are many pathological conditions that could be altered and treated. It is important that many research centers throughout the world investigate and many questions which arise from these known associations, particularly in regard to autoimmunity and treating and or preventing the growth of neoplastic tissues. Natural killer cells are a special class of large granulated T lymphocytes. Natural killer cells are spontaneously cytotoxic for a wide variety of cells. These include virally transformed cells, chemically transformed cells, lymphoma, solid tumors, fibroblasts, and normal cells. NK cells form cytotoxic conjugates with other cells, killing them within 4 hours of conjugation. That's like those panda bears back there. Of the conjugate forming large granular lymphocytes, more than 90% have the ability to act as NK cells. This is more than 50% of all large granular lymphocytes. Electrical stimulation can produce higher levels of plasma opioids, so that theoretically TENS may be a therapeutic modality in the treatment of some malignancies. Mitchell's Nobel Prize-winning theory of chemoosmotic bioenergetics stated that energies to phosphorylate ADP and ATP come from stored energy as a proton gradient across the chloroplast dipole membrane in plants and in the mitochondrial membrane in animals, rather than from chemical intermediate with a high energy phosphate bond. It is therefore theoretically possible to supply electrical energy to maintain life in a plant cell without sunlight. It also means that ischemic cells may carry on processes of life without oxygen or nutrient fuel if provided with a suitable source of electrical energy. And this may be what's happening down in those deep vents off the Pacific and the world where there's no light and they have all this plant life going on there. Maybe they got some kind of receptor that converts heat energy into electrical energy. But here again, you can re-energize a person with small amounts of low energy, low frequency currents. This is, of course, a guy who made it all up, and just like Jochen, the wings that E equals MC squared didn't exist until he thought of it. I have a picture in my office where Einstein's in a Ferrari. He's in a Formula One Ferrari, and it's got E equals MC squared on the airfoil in the back. This guy's in an air's blowing into him, and he's really happy about it. But he said a lot of interesting things, and one of them was, great spirits have always encountered violent opposition from mediocre minds. And I would like and encourage everyone to get interested in biological dentistry. I didn't really mean to bore you with all of that words and people were nodding off. I want to show you the scope of what we got to deal with here and some of the things we're using to deal with it. Now, it's very hard in one day to really get to know what we're talking about, but we want to exchange with you. We want you to communicate with us. We want to know what you're doing, and this way we can get a feel for the level of what's going on in this organization, so that we can redirect it and make it something that will change the course of dentistry. Dentistry is looked at as we have such a mechanical inheritance that we can hardly get rid of it, and we have to bring biology back into dental medicine, and this is the way to go. We have some tools to do this with. I'm going in each one of these journals now. It was a newsletter, but journal now. We have kind of an ongoing president's message, and it looks like it's just going to be a stream of consciousness thing until I get through saying what I'm saying. And I don't always talk a lot. I think when I was playing basketball when I was 17 and got knocked out, I got to get in the throat, and then having my recurrent nerve paralyzed, my voice is in the paramedian, my vocal version of paramedian position, and that means that only one of them moves and the other just stays there. It doesn't do anything. And so if I talk for a long time, I get kind of hairy and throaty, and a little headache, and I need a little something libation, a little wine or something to just lubricate that a little bit. And that brings up, what time is it now?
6 o'clock.
Man, we finished right on time today. Hey, perfect timing. Right? Worked out great. Okay. I hope you all enjoyed it, and we want you to come up to the hospitality room 402, same place it was last year, and enjoy yourself and come